We are here today to outline what I believe is the single greatest opportunity for our generation to better understand our physical well-being through technology to give a voice that is taking place in our bodies.
This is the Simband sensor module, the first open reference sensor module. And this is Simband, a modular reference platform for wearable health sensors. Designed as an open platform, it includes open software, open hardware, and even open mechanical design. Let's dive into the details. This is the dashboard. My key health signs are tracked continuously. Today, we collect heart rate variability, and temperature. Some of our partners are working on SpO2 and CO2. And again, all of those are tracked continuously. What do we mean by continuously? That's what we mean by continuously. Not just the final 76 heartbeat per minute, but the detailed sign used in the calculation. You can see the different PPG wavelengths, green from 2 different locations to compensate for location, red and blue to look at different layers of the wrist.
So Samsung diving headlong into the digital health arena. They've had a couple of forays into it in the past, but today a really big announcement, and fresh from his announcements off stage is President Young Sohn from Samsung. President Sohn, let me ask you first of all, the Simband concept, in very simple terms, what exactly is it?
Simband is not a shippable consumer product. It is a development platform, just like Google Glass may be a development platform. It is a platform that enables other sensor companies or algorithm companies to take advantage of. So one of the issues that we're trying to solve is that if you look at typical wearables, typically it's a startup-like. Many of them are trying to figure out how to make it watch and the wearables and battery issues. And then there are usually 1 or 2 people that are working on sensors and algorithm. We want to change the whole equation where we want to create a development platform where they can focus on their expertise in solving sensing problems and algorithms that can help us know more about our vital signs.
Now you showed off some videos of people explaining how they needed to improve their health. Doesn't a lot of the evidence suggest, though, that people buy bands and they do leave them in the drawer after a couple of months, and that they're kind of interested for a little time, but then they go, okay, I'm going to keep eating my burgers and fries and my lifestyle's not actually going to change that much?
Well, you know, I actually have several of those as well in my drawer, so I'm also probably a typical example of a person. But part of that is because it wasn't because I didn't care. It was more to do with it wasn't as relevant for what I was doing. It wasn't accurate. And I think we're in a very early stage of revolution of the wearable sensors and devices. So as things are getting better, I believe that these things will be much more useful.
So how long do you think it will be before we see products using your platform on the market?
Well, we are hoping in the 2015 there will be many different solutions that are adding different vertical markets, from elderly cares to all the way to exercise enthusiasts to somewhere in between.